Hi, I'm Dr. Kyle Kunze from the Hospital for Special Surgery, and I'll be discussing our recent article entitled Defining the Patient Acceptable Symptom State for the HOOS Junior and KOOS Junior After Primary Total Joint Arthroplasty. My co-authors and I conducted this study because understanding the quality of care provided for total joint arthroplasty procedures has become of increasingly important interest in the setting of policy changes and value-based care movements, especially pertaining to the specialty. The use of patient-reported outcome measures, and specifically clinically meaningful outcomes, is one way in which we may better understand what constitutes value and an acceptable outcome for these patients after total joint arthroplasty. Specifically, the HOOS Junior and the KOOS Junior are two outcome measures commonly administered and created specifically for total joint arthroplasty patients. And defining an acceptable outcome for these measures has not been studied to this point, and also may be of clinical interest. Therefore, we conducted a retrospective case series of 9,252 total joint arthroplasty cases to look to answer the question of what is the pass threshold for these outcome measures. We administered pass anchor questions to all these patients and used a receiver operator curve characteristic to define pass thresholds for both the HOOS Junior and the KOOS Junior, respectively at 2 years post-operatively. After doing this, we also stratified patients by covariate analysis to understand the potential influence of various patient-related factors and outcome measures preoperatively on the influence of pass thresholds. Surprisingly, we found that pass thresholds are influenced by patient-specific factors. For example, the pass thresholds were higher in men compared to females for both the KOOS Junior and the HOOS Junior. In addition, patients with preoperative short form 36 scores of greater than 50 for both physical and mental health components had higher pass thresholds compared to their counterparts, while age and BMI had variable influences on the pass thresholds. So defining these thresholds are important as we continue to assess value after total joint arthroplasty and attempt to better understand care and quality. However, these thresholds were only defined at 2 years post-operatively, and future research is certainly warranted to better understand what acceptable symptom states exist at longer-term follow-up. Thank you.